At the onset of the Maui wildfires here in Hawaii, Department of Human Services was one of the front runners, or I should say, one of the leaders, along with our department, to ensure that the people of Maui were able to get the services that they needed. These were people who were evacuated from Kula and Lahaina, both locations on the island of Maui. Individuals were housed at Maui War Memorial and a few other locations, particularly for some of the locations in those more remote areas. They had very little um, communication. So, what information we were able to get, we were able to pass along to the Red Cross. Aloha, my name is Lori Leaponte. I'm the Eligibility Branch Administrator for the State of Hawaii Department of Human Services MedQuest Division. We are the division that administers the Medicaid program. One of the first things that we did when the director called for assistance is have all of our staff who are located on the island of Maui serve as volunteers to assist the American Red Cross with housing these individuals. We knew and we came across many who were our own clients. Many of the clients, the staff that responded to volunteer, they began on the Sunday immediately following the wildfires. They already had a couple of days on me. I came in, I think, the Tuesday after, and immediately saw their passion and their response. But one of the immediate things that they said is, "We've seen so many of our patients, our own clients." There was one client in particular that they all wanted me to make sure that they had seen was a client who we all have, every state has, every office has. They consider frequent flyers, so it's a person who comes to our office regularly. And when the staff explained um, their interaction with him, because they knew he lived in Lahaina, they primarily spoke with him on the phone. So some people had never met him in person, a few people have. But when he came up to the desk to check in to get a hotel room, they all jumped up and they quickly put their arms around him. And we're just happy to see him. At that point, I told them, what you folks were doing was celebrating life. And those are the lives that we know we touch on a daily basis. So it was very important for them to continue the work that they're doing. At the same token, while we were, I'm going to cry. Oh, okay. At the same token, while we were helping check individuals in, we were able to ask if anybody needed health insurance, because we knew at that point that might be the one time initially where people will need to receive some sort of medical assistance. And knowing that people had lost so much, we thought that would be a perfect opportunity to reassure people that if they're eligible, we wanted to help them. That was one of MedQuest's probably first response. So we partnered with them to come to the shelters and assist the clients with enrolling in healthcare. This way, because a lot of them needed some sort of healthcare, and we all know that eventually we know that people will need some sort of probably behavioral health care. And we did see that over the month that we have been working directly with many of the people in the public. That is the help that they need. And so many people were very grateful. And I think for the people who were our clients there on Maui, just to put face to name, because either they've called us or they've come into the office, that was recognition for them that their life was important and that they mattered. I think one of the highlights for me and this is where our team comes um, into play, is as soon as the tragedy happened, everyone was on the phone. Everybody was asking, how can we help? So that included not just our team from the eligibility enrollment portion, but it was our healthcare outreach branch. It was, of course, our administrators. It was our healthcare services branch. It was our finance office. It was our systems office. It was our clinical standards office. Every office that imaginable for us that could have reached out is who reached out to be part of Medicaid. And I'm going to say this probably more nationally because every single state at some point in time will, if they have not already experienced some sort of tragedy, very similar to us here in Hawaii. I think the importance of working with Medicaid is really, it's about lives. It's about saving lives. And although we in our profession, we may not be the doctors and nurses who are in the emergency rooms or in the physician's office um, directly serving the patient themselves, I think the importance of what we do for medical um, is so important. I think not just us making sure that the people are insured, medically insured, but that they do receive the services.
Because it's that foundation that allowed the team to immediately take action the moment that the fires happened.